Hey guys, it's Hina Sheth here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as in the suburbs in the main line in Narberth, Pennsylvania. And we are a practice of physical therapists that specialize in treating orthopedics, but we are also very well known for treating problems around the hip, pelvis, and the spine, and any combination of issues that someone might be happening there. And today I want to talk to all of you men who might be dealing with an issue that feels like you have a flu in your pelvis. And the reason why I'm using those words is actually because it comes from my clients. When I am speaking to my clients who are men, many of them may say, you know what, I just can't put my finger on it, but it feels like my pelvis has a cold or there's a flu. And I feel it either all the time, or I feel it when, after I have intercourse. That's a big one, that they feel like they start developing the flu in their pelvis after having intercourse. Or perhaps it's with a certain activity, or, who knows? There could be a lot of different links as to when you might be feeling this. But, if you're dealing with any of these symptoms that feel like that, then I'm going to explain to you what it could be. So many of you, perhaps you have already gone to your either primary care doctor, you've gone to your urologist, they're not finding anything. Perhaps they maybe put you on some antibiotics because they weren't sure if you potentially had like a small infection, and so they wanted to put you on a round of antibiotics. So if you've already been on antibiotics, and most of the time in an absence of an infection, it's probably not going to give you full relief by any means. And if any reason why, it might give you temporary relief, and I'll explain why that temporary relief might be happening. But chances are, if you're having it feels a little bit better, but then it just comes back, or it feels like it doesn't do anything at all, then most likely it's what's called a pelvic floor issue, meaning that there's muscles inside of your pelvis that are not behaving. And then there's also fascia, which is basically like a cobwebby type material that surrounds all of your organs. So in you men, it's going to surround your prostate, it's going to surround your bladder, it's going to surround your intestines, and it's also going to attach in and around all your musculature. So that fascia can also tighten up, making everything feel very congested, making it feel like your pelvis just feels heavy and full, and you're just not happy. So that's basically what might be going on. Now, I'm going to show you a little picture. So here's a picture of a model of the side. If you take a male and you cut the male kind of a part of his body off from the side, this is everything you're going to see. Okay, so this is the spine. Here's the rectum. Okay, you've got your bladder. You've got your prostate. You've got your, again, this is your pubic bone right in through here. So this is everything that you're kind of seeing in and through here, okay? And so the pelvic floor muscles are actually right in through here. And those muscles, you can see, they actually give function to your rectum, but they also play a part in sexual function as well as urinary control, okay? And then all of this area right here, this is what I'm talking about, is there's tissue in and around. I mean, you can't see it on this model, but imagine that there's cobwebby material that surrounds all of these different organs, okay? Now, if this musculature gets tight, as well as the fascia gets tight, then that's where you might have this congestion type syndrome. Now, why does this happen? It could be, there could be a million different causes as to why this happened. We treat a lot of men in our practice, and everyone is different as far as how and why their symptoms started. For some men, it was simply stress. And what do I mean by stress? It could be stress from something that was more acute, meaning it was like a very concentrated period of stress. I had one of my male patients that said he was driving for 2 hours in a bad snowstorm, and he just felt like he was on edge for the entire 2 hours, and that's when he started noticing his symptoms coming on. That's stress. I have another male patient that may say, I had a death, my father passed away, and ever since my father passed away, these symptoms have started. So that could be more of an acute, or not acute, more of a chronic episode. but it started acutely. Then I have other men that say, hey, I just have a job that I've hated for 5 years, or I'm in a, unfortunately for you, I'm in a marriage that I'm not happy and it's very stressful. And so all of these things, you know, have led to me feeling this way. And for some men, it's like this gradual buildup of time that this has happened. And for other men, it's been something that quickly happened overnight. And why did yours take overnight and somebody else took a long time to develop? It's hard to say. A lot of different factors. This is where, when we actually evaluate you and take your history, that kind of helps us to put the pieces together. But the other thing sometimes that can happen for you men is trauma. So if you've had surgery, if you've had a sports injury and you got hit, any of those things, any type of trauma can also add to the symptoms that you might be feeling. So I hope that kind of makes sense as to what you're feeling, why you might be feeling that. Now, what do you do about it? So we are a group of physical therapists at our practice. We're known for treating pelvic floor and pelvic floor dysfunctional issues. And so we specialize in treating a lot of issues that are around both for men and women. But like I said, this is a video for you men, but any of the reproductive organs, any of the gastrointestinal organs, as well as the urologic organs that might not be, that might be giving you symptoms, but perhaps they're coming from a musculoskeletal origin, meaning they're coming from the fascia, the muscle, tendons, ligaments, bony issues that might not be working well. And so we work on all of that to balance out all of that tissue, all of the joints, all of the muscles, ligaments, etc., to create a healthier environment so that you get better blood flow, you get better lymphatic flow. Lymphatic flow is all the fluid that, you know, that can create swelling, but on a typical person that doesn't create swelling, or I don't want to say a typical person, but, you know, a normal person that hasn't had trauma or anything like that, you're not walking around with swelling going on, but lymph is the stuff that can cause swelling. So to make sure you have healthy lymphatic flow, circulation, and just general, you know, muscular contraction and relaxation. So and what techniques we use, you know, we've been working on this for 20 years. So there's a host of different techniques that we use with our hands to improve the health and balance of the pelvis. And so that's what we can do to kind of help the feeling of that congestion that you might be happening. So for you men that you feel like you're kind of running around in a rat wheel because you're not getting anywhere in the medical community trying to figure out what's going on, most likely, actually, I can bet my life on it that if you have had every workup and nothing has come out, and you haven't thought about that this could be a muscular fascial issue, then it's probably a muscular fascial issue. And we see men like you every day at our practice. So I hope this video was helpful to you. We have lots of other helpful YouTube videos that go into like nerves and other things like that you might also be dealing with on top of a congestion. So this is just maybe one symptom that you're feeling on top of many others. So combine it with a bunch of my other videos. It'll kind of start making sense and you can piece it together. And it's a no-brainer if you live in and around the Philadelphia or surrounding suburbs, or maybe even the surrounding states. We see people from Delaware, New Jersey, Maryland. So if you live in and around this area and you want our help, then jump onto our website. It's rebalancept.com. That's REBALANCEPT.com. We have a Facebook page. We've got, like I said, a lot of YouTube videos. Sign up for our newsletters because this is where you'll see a lot of our blogs, and then we also have my team of colleagues that also write articles, and all of that can be helpful to you, and you may even qualify for a free phone consultation. So I hope this video was helpful to many of you, and I hope you have a wonderful day.